My health started getting worse and worse and worse. Until one time I got real bad. So bad that I couldn't even take 2 steps without having no breath, couldn't talk, couldn't move, couldn't do nothing. I couldn't even take care of my children.
And I lost a lot of weight. I went down to 52 pounds. So I didn't have that much energy. It was like, okay, I did so much and I stopped. I got drained too quick. I used to just give up.
I was in and out the hospital, had pneumonia a few times. I had little personal problems too. A lot of times when your mind's not right, you don't take your medication accordingly. I had so much medication that it was hard to take, and my numbers weren't doing that good.
Decades after the AIDS epidemic began, living with HIV in the United States is still hard, especially in the nation's disadvantaged communities, where access to health care can be a challenge. New medications and therapies that prevent the onset of AIDS are now more accessible, and many of our nation's great hospitals are located near the inner cities. But certain populations, like Black women, continue to have higher infection rates of HIV, as well as higher death rates from AIDS. In an era where it is now possible to live a long, healthy life with HIV, it is important to ensure that all people can benefit from new and improved medical resources. This means reaching out to persons who face social, cultural, or economic barriers to care. In 1997, a group of community activists and concerned physicians created the Pact project in order to better serve Boston's HIV population. Pact, which stands for Prevention and Access to Care and Treatment, offers people with HIV a personal path to a healthier life. Pact offers all of its services at no cost. The project is a result of a partnership between Boston's Brigham and Women's Hospital and Partners in Health, a nonprofit organization whose worldwide mission is to provide health access for the poor. To be eligible for Pact, you must be HIV positive with a history of poor adherence to medications. Pact helps its HIV clients to take the best advantage of available healthcare options by providing each person with a personal health promoter, or HP as they are referred to at Pact. Each health promoter is knowledgeable about HIV and is trained in counseling and support. He or she also acts as a bridge to the many social services and medical personnel who can help a client.
And so what these health promoters do is that they go to these individuals' homes, they get to know them, develop a relationship, get to know their family, understand what it's like for them to live with HIV, what all the different issues are that they face going day to day with their illness. What are the struggles that they face in getting good health care and taking their medications, and then work with them very closely to try to identify goals. What do they want to do with their lives? How do they want to live with HIV? How do they want to engage with their healthcare providers? And then help them take medications that they need to live long and be healthy. And the health promoters work with the individual's doctors, case managers, social workers, so it's all very complementary, with always the patient or the individual with HIV being at the center and directing what they want for their health.
Some Pact clients do not wish to share their HIV status with neighbors, friends, or even family members, so health promoters do not wear any identifying clothing and are trained to respect the client's privacy at all times. When they are visiting someone's home, they will never talk to anyone other than the client about why they are there.
You know, visiting someone at home is a very different feel than meeting them at an office or doctor's office, because it's a very intimate setting. It's, you know, you being part of someone's everyday life, and it's a privilege for me as a health promoter to have the opportunity to be in someone's home. People tend to be more relaxed, more open, because it's their home setting.
At first, I was skittish about it. I'm independent, and it was like losing part of my independence. And then they started talking to me, I started talking more, and then it's like I started opening up with them, meaning a few personal things get discussed and stuff like that. And the more we talk like that, the more the more it became friends. And you can always say, no, I don't want this. In the hospital, someone's watching you, monitoring your every move, your every this. Why can't it be in your own home? You feel more relaxed in your own home. I can really believe them. If they say they're going to help me with a certain thing, I can see it. It gets done. It really gets done. Like I have housing problems right now. I don't have Section 8. I'm paying market rate for this. And I'm on a fixed income. Magali, she's working with me with housing and stuff like that. She got me connected to AIDS Action Committee. Certain things, if you need it, it will be worked out along with taking your medicine. I like that.
One of the things that we offer is that we're not here to judge, we're here to support, and we're not here to rob people of their independence. It takes time to build trust, to build a relationship, trusting relationship with someone. So for many clients who are new to Pact and receiving services from Pact, in the beginning, both for the health promoter, like myself, and the client, it can feel uncomfortable. However, experience has taught that within a few weeks, for some people a few months, it becomes a very comfortable, open, honest relationship. We want to give them time and be patient and understanding until they're ready to accept our program. So if anything, we empower people and encourage them to be independent. We cap on skills that they already have.
Taking the proper dosages of the HIV medicines at the required times, while seemingly easy, turns out to be one of the most difficult aspects of dealing with HIV. There are many reasons that people might have for not being able to follow or adhere to the complicated pill regime. But taking the pills is by far the most important act that someone with HIV can do to maintain their best health.
Most of our individuals who are enrolled in the project who have HIV come to us with very low CD4 count. That means their immune system is weak because their HIV has been out of control for some time. And that basically means that they're very vulnerable to getting sickness and having to be hospitalized. And we also look at something called the viral load, which is a measure of how strong the virus is in the bloodstream. And many times these patients have very high viral loads because for whatever reason, taking the medications has been very difficult. And what our health promoters do is that they help the person take their medications better on a regular basis. And so what we see is that patients go from having very weak immune systems, very high viral loads, to having stronger immune systems and their viral loads going way down. And in fact, probably about 70 to 75% of our patients after 9 to 12 months of being in our program are able to have what we call an undetectable viral load, which means their viral load gets so low that we can't even measure it in the bloodstream.
Another important service that PACT can offer you is Daily Observed Therapy, or DOT. In this program, a DOT specialist will meet with you every day to help guide you in taking your HIV medicines. This usually involves someone coming to your home, but if clients are uncomfortable with that, meetings can be set up in the PACT office or anywhere that's convenient. DOT isn't for everybody, but for some clients, it's a lifesaver.
I've been in the program for 3 years. I was having very complication of taking my meds, and my doctor was the one recommending me to Pat. She thought it would be good for me. The deal was I was going to try to take my medicine on my own, and of course I failed. It was not working. I found every little excuse not to take them. Oh, I'll take them later. Oh, I didn't eat yet. Oh, I gotta go here, you know. So I started realizing where the problem lays, and it was with me and my brain. I started getting sick again, so what I did was I asked DOT to come to my house, and she set it up. They started coming, believe it or not. 3 months, 6 months later, T-cell rising, viral load undetectable, you know, and it was the constant of taking my medicine, DOT coming to the house, and if something is not going right, they'll call you and see if they, you know, we need their help. So they are great support. And when they say confidential, it is confidential. You could trust them. You could really, really trust them because they are really, really confidential. And I love that. I had met so many people that they're not here for the money. They're not here because they think they're getting something out of it. They're here because they really, really, really care. And they care about you, they care about your family, they care about your friend, they care about your health, they care about everything. So with them, I could talk. They're not my nurses, they're not a case manager, they're not a doctor. They're my friend, they're part of my family. So I enjoy it.
Nice to see you again.
In addition to home visits, health promoters will accompany a client to their medical appointments if the client feels that they could benefit from some extra help in understanding their medical situation. Sometimes it is language itself which acts as a barrier to understanding, and Pact can provide health promoters who speak Spanish, Portuguese, or Creole in addition to English.
No. Yo voy a hablar con mi jefa. Our role is to provide support, advocacy, to walk with somebody, to be a bridge between the world of the people that we serve and the world of all sorts of providers, whoever those providers may be. And that involves a lot of education on our part so that we can give the education and information to the people that we serve. I'm not a housing expert. I'm not a doctor. I'm not a lawyer. But in various different situations, somebody may need help with immigration. Somebody may need help with dealing with housing. Somebody may need help with talking to one of their doctors. Our role is to kind of be a facilitator and to show people the resources that are available. This is ultimately about a person's health. So we really want to empower that and respect a person's decisions. Our ultimate goal is, in a sense, to work ourselves out of a job, is that we empower people so much to say, I can call the doctor and ask the question. I can call the pharmacy. I don't need my health promoter to do this for me anymore. Maybe he did in the past, but I'm able to do this, and I can do this on my own. So that's our goal, is to get people to that point.
Pact functions both as a service project, where we help individuals, and as a research study. By learning more about the community that we serve, we are striving to reach a greater number of people and offer the kinds of services that are most useful to them. We ask all of our clients to fill out some questionnaires, and like all requests from Pact, your participation in these studies is voluntary and always kept private. For some of these surveys, you will receive a food voucher for your time and participation.
Most of our patients actually like the opportunity to share their experiences, to talk about what it's like for them to participate in the program, as oftentimes they don't have a lot of opportunity to share their experiences, their side effects, what their barriers and challenges are, and this gives them an opportunity to voice those concerns, because this program is very much based on patient feedback. When patients tell us, we like this, we don't like that, that's what we use to make sure that the program is structured in the best way possible.
There is no specific time commitment for being in Pact. Most people receive services for about a year before graduating from the program. But you can stay in Pact as long as you need us. The goal is to use Pact until you can take your medications on your own and stay healthy.
A lot of our patients who are enrolled in Pact, who have HIV, are able to, for the first time in many, many years, sometimes 10 years, 11 years, get control of their disease. They go from being sick, having weight loss, not being able to take their medications, feeling very lonely, feeling depressed, to feeling like they have control of their disease, able to take their medications well, start to gain weight, see their immune system grow strong, not be sick, not to have to go into the hospital. Many of them are able to go back to work and feel like they're part of their families and their communities, things that we really like to see.
I would say this as a Black woman, an immigrant woman, a woman who's part of a community that's been quite hurt and destroyed by this disease. I would encourage you to join the Pact family, because a lot of people are dying from this disease needlessly. Knowledge is power. We have the resources here. We just need to know how to navigate the system and use those resources, and that's what Pact's about.
The energy's back, and I'm even more involved in my oldest son's school. I could see myself old and gray and playing with my grandkids. That's my goal. That is my goal.